She's going to present about scale-up zinc sulphate used for management of childhood diarrheal disease in Zambia through community health workers and women's support groups. So we call upon the presenter Idi Mwinyi from Public Health. So
I'm
please start your
Idi Mwinyi. Today the topic I'm going to present is how to scale up zinc sulphate use for management of childhood diarrheal diseases in Zambia through community health workers and women support group. To start with, I have to mention that this is a literature review prior to the actual research, actual project which is supposed to be conducted on the ground. As a summary, diarrhea is one of the commonest diseases which affect under 5 children, and poor access to safe water and adequate sanitation continue to be one of the main drivers of diseases in the country, which is Zambia. In the country, different strategies have been put in place for the government to help reduce diarrheal case fatality rate. And zinc sulphate supplementation is one of the strategies, though its implementation have been partially challenged by a number of barriers. Those kind of barriers, some are geographical barriers, financial barriers, and in line with human resource. And to prevent delay in the treatment, the country has introduced what we call integrated community case management of diarrhea, which is run by community health workers. But despite all this, the delivery of health services is still unsatisfactory, and the child mortality rate due to diarrhea is still high. Having said that, we intend to conduct a cluster randomized clinical trial that is going to assess the impact of training of community health workers and establishment of women support group on the use of zinc sulphate as adjuvant therapy in childhood diarrheal diseases. This is at community level, especially in rural area of Western Province of Zambia, where integrated community case management is being implemented as compared to where there's no implementation in other areas. But prior to conduct such research, we did conduct a literature review, which I'm going to present now, published clinical trial that were conducted in low and middle income country where Zambia belongs, and methodology and results are presented below. As a background and significance, in the country, diarrhea is one of the commonest diseases affecting under 5 children. This is according to UNICEF Zambia in 2010. Among other diseases, we mentioned there are respiratory tract infections, there are malaria, there's also malnutrition which comes on board, and other conditions like HIV/AIDS in children. We also reported that poor access to safe water and adequate sanitation is one of the main drivers of diarrhea in the country. And Zambia, by 2010, has introduced integrated community case management in 23 selected districts out of 89 by 2010. This was a pilot research which was started by 2010, which is yet to be expanded to all the other districts countrywide. The key message is the use of zinc sulphate as adjuvant therapy for childhood diarrhea. We mention adjuvant therapy knowing that basically for diarrheal treatment in childhood, we always use oral rehydration salt, which is ORS. But in addition to that, we're adding zinc sulphate. Challenges, there's inadequate supply. We mentioned that diarrhea is one of the commonest diseases affecting under 5 children, And this is basically due to poor access to safe water and adequate sanitation, and one of the main drivers of diarrhea in the country. And hence, Zambia has introduced integrated community case management in 23 districts out of 89. This was by 2010. But the whole idea is to extend the experience out of the 23 to extend the practice countrywide. The key message we used during that period was the use of zinc sulphate as adjuvant therapy for childhood diarrheal treatment. As I alluded to earlier on, for management of diarrhea in children, we always use ORS, which is O reduction salt, but we introduce the use of zinc sulphate. And the challenges, the inadequate supply of zinc sulphate, and also geographical barriers. As I mentioned, Zambia, especially Western Province, we have got areas whereby during rain season they are completely cut off, they are flooded, hence making inaccessible those areas. We also have challenges in terms of distance and cost of transport and availability of qualified staff in rural area. This is just to emphasize on human resource challenges the country is facing. Hence, they use the idea of bringing on board community health workers who will be the first line in the community. Hence, increasing awareness in the context where this service is available, and the community health workers at community level, will they have a positive impact in assessing zinc supplementation and then reduce diarrheal mortality? So this is one of the questions we pose ourselves to justify the kind of research we are going to conduct. The P diagram, this diagram, or the P diagram, and it's simply showing at 12% the mortality rate due to diarrhea and among children under 5 years old. And the next one, it reflects the proportion of population accessing safe water alone in urban area and in rural area. In urban area, we are about close to 90% of people accessing safe water. But in rural area, we only have an average of 40% of people having access to safe water. Now, combine safe water and sharing sanitation facility in urban area, we are about 55% of children of population accessing both improved water, it means safe water, and also not sharing sanitation facility. Whereas in urban area, we are close to 15% of those who have got both improved water and also not sharing sanitation facility. The method used for our research, we search through Medline, we use PubMed database and also Cochrane database. And our main focus was to identify literatures reporting on the effectiveness of oral zinc in reducing duration and severity of childhood diarrheal episode. And the literature were published in developing country where Zambia belongs, and were published in French and English languages. And we restricted our search to clinical trial, and there was no time limit attached to our search. In PubMed, mesh term used were diarrhea, zinc therapeutic use, and child. For Cochrane TRCT, we use diarrhea, child, zinc, and therapeutic use as keywords. As a result, after screening for clinical trial, focus to the topic under review and duplication, 112 articles were excluded for not being clinical trial, whereas 24 do not meet the main focus of our study, either because they were not related to the effect of zinc supplementation in reducing duration and or severity of diarrheal episode, or published in developed countries or in languages other than English and French. Only 28 articles were selected. 12 had the full free text and 16 had the abstract. By the end of the screening, and more studies were conducted in a developing country. Randomized control trial assessing the therapeutic effect of zinc supplementation in childhood diarrheal diseases have reported a wide variety of diarrheal diseases outcome, and outcome vary with different considerations. The first one was the impact of zinc supplementation in childhood diarrheal diseases. Then the impact of zinc and other micronutrient supplementation in childhood diarrheal disease. The third one, zinc and oral rehydration solution in acute diarrhea. And the fourth one, zinc in malnourished children with acute diarrhea. As a conclusion from our findings, we concluded that zinc supplementation reduces diarrheal duration and treatment failure or death in persistent diarrhea. It also decreases the severity of diarrheal episode. At a 10-day course as well as 5 days course has proven to provide a prophylactic protection against future episodes of diarrhea for 2 to 3 months after the initial episode. Though further studies are needed to provide comparison of zinc effect in different age groups based on baseline investigation, its interaction with other micronutrients and its accessibility in the community were provided. So this is the summary of our literature review we did prior to the actual research which is supposed to be conducted. Thank you very much for your attention.
Thank you, Mr. Idi Mwinyi, and that was a wonderful presentation. And dear participants, please post the question in the chat box so that Mr. Idi will reply here. So that was the first question. I didn't get the RCT design.
Okay, to answer, what we conducted is a literature review, but we are yet to conduct an actual research on the ground, which will be a randomized controlled trial. And we intend to organize a cluster randomized controlled trial whereby we go in community, select groups in the community, and for each one of them, they'll be allocated to either zinc supplementation, or the other group will be compared to another group where zinc supplementation will not be added. And by the end of the study, we'll be able to compare both groups with and without zinc supplementation.
So next question, that from Kahinde.
For Kahinde, rather than saying this is a scale-up zinc sulfate, would you not say this is more a systematic review? Yes, indeed. This is a systematic review. I think I alluded to when I started my presentation. We first conducted a systematic review prior to conduct the actual study in the community. So what I've presented is a systematic review, and the actual research on the ground, the project, it's yet to come.
So next question from Taban, Charles.
Okay, for children with, I assume it's moderate acute malnutrition, is this formulation of zinc sulfate and ORS recommended, or we go to Rhizomo straight? Okay, basically for malnutrition, we go for Rhizomo. That as a clinician, I think we all are aware of that. The next question. Okay, is there still the supply of the commodity to cover the community health workers in the province? Yes, indeed. We have a challenge in terms of supply of commodity to support community health workers from wherever they are, in which the facility where they are coming from. I think I alluded to it when I mentioned the challenges we're facing, because basically the supply we are getting supply of zinc sulfate from central level, which is the Minister of Health, with support with other partners in the country. Okay, from Yomi Yang, what means are you considering to distribute the zinc sulfate to hard-to-reach areas? That the whole sense of bringing community health workers, because those community health workers, they stay in the community, they know their population, they know their household, so it's easier for them if they get supply to have access to those children, those who are in need of zinc sulfate supplementation. So that they always have to bring both community health workers for those who have been already 10, but also bring on board the women support group, which will help improve the supply in terms of zinc supplementation. The next question for Muhammad. Your literature review reviews high success rates for zinc sulfate in several countries similar to Zambia. Rather than do another randomized control trial, why not conduct study that address the challenges that your review highlighted? Yes, indeed, most of the country with result as it appears successful, yes, they did use community health workers, but as a country, as Zambia, by 2012 we had only about 5,600 community health workers trained countrywide, which is inadequate to cover up for all the hard-to-reach areas. So that was the idea of bringing on board women support group. For the women support group, they'll need an orientation. For community health workers, they basically undergo 1 year, full 1 year training before going on the ground. So using the MADA, the women support group, we think it will be more easier to have access to children who are sick in the community. That's the whole sense of us conducting a randomized control trial involving both community health workers and also women support group. From Paulina, in Nigeria, ORS and zinc come in the same package given to patient. Is it different in your country? For us, it's different. So they come in different package. There's ORS on its own, and also there are zinc sulfate coming in a different package. Good and interesting presentation. Please, we will be glad to know the outcome of the actual study in the community when it's done. I believe the study will be conducted soon. Well done. Thank you very much, Chiloli. As soon as we are done with the research, if Texila give us the opportunity, we'll be able to share on the same platform. From Tumwa Mwanawabene, amongst challenges you mentioned supply and geographical, among others. What are you planning to avoid such during the actual research? Prior to that, the idea of research, it means there will be areas which will be pre-selected, taking into consideration of geographical accessibility. So when conducting a research, there will be area that will be pre-selected. In terms of supply, is to contact NGO and to get support from other organizations which will be able to supply us in enough zinc sulfate during the period of research, hoping that during that period we'll be able to resolve the geographical constraints and also in the problem with supply. From Steady Faith, you intend to work with women support group. What then happened to those areas with no such support? In fact, those areas, those women, they'll be recruited and oriented during the period under study. So prior to start the actual research, those women will be selected, okay, and oriented on how to provide health education and how to use zinc sulfate in the community. From Abimnui patients, what measures will control the misuse of zinc sulfate? Okay, we intend to use community health workers and women support group, hoping that these two, they are well trained and well oriented on how to use zinc sulfate. So as for community health workers, they have got access to every household in the community. Hence, they'll be the one providing and supplying zinc sulphate in each household where children with diarrheal disease are in need. From Taban child, what is the efficacy now about zinc sulphate used in children less than 6 months, old? Yes, on our literature review, it was reported that the efficacy is the same, both for those children below 6 months old and above 6 months old. The efficacy remains the same. It reduces the mortality for about 12% alone. But in addition, with ORS, it goes up to a reduction of 65%. From Idi Mwinyi patient again, will there be a system of identifying the children with diarrheal disease? Yes, it's a two-way things. There are those children who are brought by caregivers, mothers or guardian in the hospital, and there are those who will be identified from their respective communities. So in both ways, we'll be able to identify children and to incorporate under our studies.
Dear participants, please hold for the presentation done by Mr. Idi on the topic Scale Up Zinc Sulphate Use for Management of Childhood Diarrheal Disease in Zambia through Community Health Workers and Women Support Groups. Here the poll is ending here.